Hi, my name is Courtney Lewis. I'm a student in the MSN program at McKendree University. Today I'm going to be talking to you about the problem of access to care in rural populations. By the end of this presentation, you will be able to identify 3 factors that contribute to health disparities experienced by rural populations, identify 3 additional factors that migrant farm workers experience specifically that impact their access to care, and identify 3 benefits that mobile clinics can provide to rural communities to address problems with access to care. In general, rural populations have a lower life expectancy than the urban population in every demographic category. Overall, the life expectancy of an adult living in a rural community is 76.8 years compared to an urban community of 78.8 years. And this pattern is the same for men, women, and across all races. A combination of culture, economy, and geography play a role in rural healthcare, access to care, and barriers to receiving care, and I'll go into more detail about these factors and how they affect the health of the population. This difference in health outcomes and life expectancy is due to a number of reasons, but there are very specific barriers in place that contribute to health disparities among the rural populations. Geographic location, specifically being geographically isolated, leads to fewer resources in an area, fewer providers, and fewer specialists, making accessing care more difficult. Geographic isolation also contributes to fewer employment opportunities and higher rates of unemployment, and we know that with employment often comes health insurance and the financial freedom to choose healthier lifestyle choices. So when the unemployment rate is higher, this could lead to poorer health outcomes for the population. There is also often limited public transportation opportunities in rural communities. In urban areas, there are public buses, trains, subways, or their cities are just more walkable in general. This gives an individual more options when needing transportation to medical appointments. In rural areas, often the only option for those who don't have their own cars is to set up private transportation, which can be expensive. There are also risky behaviors that those living in rural communities tend to engage in as well. For example, smoking, alcohol abuse, and not exercising, which can lead to being overweight or obese. There are many ethical concerns when it comes to providing health care in rural areas. As discussed, there are already many health disparities in rural areas: lack of providers, transportation problems, no health insurance, etc. These disparities can be amplified for migrant farm workers. Migrant farm workers often move frequently to follow where their work goes. This makes it more challenging to provide continuity of care to these patients because they are constantly moving and are not always able to follow up with their healthcare team. Add language barriers on top of that, and that makes it even more challenging for a migrant farm worker to develop a relationship with their healthcare providers. Migrant farm workers and farm workers in general also often work with dangerous farm equipment that can lead to injury. Also, long-term farm work can lead to the development of many other conditions, including respiratory conditions, arthritis, communicable diseases, and more. Lack of insurance can make farm workers hesitant to seek care, and for migrant farm workers, if they are undocumented, then that will really impact their choice to seek care or not. There are several improvements that can be made to health policy in order to address health needs and access to care in rural communities. By putting more focus and funding on public health services and health prevention and education measures, we can hopefully address problems before they develop. Also, creating more legislation to provide protections and a safety net for undocumented workers is necessary as well. And of course, creating a system of universal health care would help to address some aspects of access to care in rural populations, such as ensuring that even those who are unemployed, low income, or without health insurance still have equal access to health care. Although a common misconception is that rural America is predominantly white, the landscape and racial makeup is quickly evolving. As mentioned earlier, there is a large population of Hispanic migrant farm workers in the Southwest. There is also a large concentration of African Americans in rural southern areas. It's important for healthcare workers in rural areas to be prepared to meet the diverse cultural needs of these different populations and be culturally competent when providing care. There's a stereotype that LGBTQ individuals tend to gravitate towards large cities to find more acceptance. However, almost 20% of the LGBTQ population still lives in rural areas. Unfortunately, there is still discrimination against LGBTQ individuals in not only rural but also urban areas. LGBTQ individuals often struggle with accessing care due to healthcare providers refusing care or not creating a respectful, safe environment. They can also struggle with finding employment due to discrimination, which, as we know, employment plays a major role in one's ability to maintain their health. Health literacy is an individual's ability to take in, understand, and utilize information to maintain their health. Many factors impact someone's level of health literacy, including education level, reading level, any language barriers, and ineffective teaching methods by healthcare providers. And by this, I mean that it is important for healthcare providers to not use confusing language or complicated medical terms when educating your patients. You should adjust your teaching methods to your patient's literacy level, allow plenty of time to ask questions, and use teach-back methods to ensure that your patient is understanding what you're telling them. When someone has a low health literacy level, it can have a major impact on their health. If an individual does not fully understand how to take their medications, what follow-up care is necessary, like diet restrictions, activity restrictions, the need to go get follow-up blood work, for example, then this can lead to complications, missing appointments, and eventually hospital readmissions. It can often look like these patients are non-compliant with their care, but it's important to assess why they are non-compliant because it may be due to not fully understanding what they should be doing to care for themselves, and more education may be necessary. Several social determinants of health have already been discussed today. To review, many social factors have an impact on access to care in rural areas. Lack of public transportation, unemployment or low-paying jobs, lack of healthcare providers or specialists in your area, discrimination, education level, safe, clean housing, and more are all social factors that impact an individual's ability to maintain their health. So now that we have a better understanding of the scope of the problem of accessing care in rural areas, what are some interventions to address this problem? One very innovative idea that I found is to utilize mobile clinics. Mobile clinics include vans, buses, or any other mobile units that have been converted into clinics that can travel to remote areas and provide care to patients who otherwise would not be able to make it into a clinic. There are several benefits to mobile clinics. They are able to provide healthcare services in geographic areas that have shortages of healthcare providers. Mobile clinics offer many different services such as immunizations, screenings, dental health services, lab services, and disease management education. They can also provide resources for telemedicine visits for patients that need to follow up with specialists or providers in other geographic areas. These mobile units can also be taken to schools for health screenings for children or to nursing homes to address the elderly populations. They could also be particularly beneficial to provide care to migrant farm workers who may be more prone to move frequently and often have difficulty following up with healthcare providers. Mobile clinics also help to improve health across the continuum of care by improving access to services at the prevention and tertiary levels. And by utilizing referrals to outside providers and telemedicine visits, it helps improve follow-up care and hopefully improve health outcomes in the long term. When utilized effectively, mobile clinics could address many social factors and ethical issues that impact access to care, like geographic isolation, transportation issues, lack of providers, financial barriers, and more. Overall, mobile clinics could be a great solution to improve rural communities' access to care. In conclusion, it is clear that many factors affect access to care in rural communities, and these factors can create health disparities, including geographic isolation, lack of healthcare providers, transportation difficulties, fewer employment opportunities, and more. Diversity and culture also have an additional impact on care. Migrant farm workers, in particular, experience all the health disparities that the rest of the rural population faces, with a few unique challenges as well. It's often more difficult to provide continuity of care to migrant farm workers due to frequent moving. Language barriers and undocumented status are additional barriers for migrant farm workers. Although this is a significant problem that requires a multi-level response, there are some policies and interventions that can be implemented to address it. Working to improve legislation that provides additional protections and safety nets for migrant farm workers and undocumented individuals is important. It is also necessary to fund public health and prevention and education measures to help prevent health problems and address the needs of patients who have a hard time following up with their healthcare team. Mobile clinics are one intervention that can be utilized to improve access to care in rural areas. Mobile clinics can be used to serve geographically isolated regions, can utilize telemedicine services, can be used to provide services to children, elderly, and migrant farm workers in their own environments, and can provide necessary services like education, immunizations, screenings, and dental work. Thank you for listening to my presentation, and now I will open it up to any questions you may have.